Good afternoon, and thank you for joining us for the November 3rd COVID-19 virtual news conference. My name is Mariah Miracle. I serve as a public information officer in the COVID-19 Joint Information Center. Today, we're joined by Humboldt County Public Health Director Sofia Pereira and County Health Officer Dr. Ian Hoffman. I'll start with a brief update from the COVID-19 Joint Information Center. 9,390 Humboldt County residents have tested positive for COVID-19 as of the most recent report yesterday. In the month of October, 779 new cases were reported, which is down significantly from the 1,444 new cases recorded in September. And last month, 31 hospitalizations and 16 deaths from COVID-19 were reported in our county. The Pfizer COVID-19 vaccine has been granted emergency use authorization by the Food and Drug Administration, and the CDC, Centers for Disease Control and Prevention, has recommended it for children in this age group. But Dr. Hoffman and Director Pereira will speak more to that. As for the nearly 119,000 Humboldt County residents aged 12 and older who are currently eligible for vaccination, almost 80,000 or 67% are fully vaccinated. About 8,000 more are partially vaccinated, which means that more than 31,000 eligible county residents remain unvaccinated. The community information line is available to answer questions related to COVID-19 in English and in Spanish. Reach out to us at 1-707-441-5000, Monday through Friday from 8 a.m. to 5 p.m. Now we'll hear from Public Health Director Sofia Pereira.
Good afternoon, everyone. So we are seeing and continuing to see a strong interest in boosters for those that are eligible. And we are seeing folks show up in big numbers to the clinics that we organize. We just are hearing that there's a lot of demand for it, which is great. I did just want to remind folks that there are many places to get the COVID vaccine. We do have the mobile clinics with our SNAP nurse team that is going all over the county, working with community-based organizations and schools. The pharmacies are providing COVID-19 vaccines, and there's also healthcare providers providing it. So if you're interested in getting a booster or your first or second dose, please go to myturn.ca.gov or contact your local pharmacy if you're seeking the vaccine. Our public health managed clinics are going to continue to provide boosters, but just also want to ensure and make sure the community understands that those that are seeking your first or second doses, I just want to say to you, we have enough vaccine for you. We will prioritize you and make sure that you get your shot if you make it to one of our clinics, even if you show up as a walk-in. We want to make sure that we are providing that opportunity for you, because we know that to get through this pandemic, those that need to get to a full vaccination is really key. So we just want to make that really clear, since there is a lot of demand for boosters. There's enough for you if you are needing to get fully vaccinated. As Mariah mentioned, Pfizer was approved for 5 to 11-year-olds through emergency use authorization. This is really exciting news. We are seeing parents and caregivers are already signing their kids up for appointments here locally, and we expect MyTurn to be updated probably tomorrow to make appointments with the local clinics that are on the MyTurn site. So just please, stay tuned to that. You can reach out to your local pharmacies if you're seeking a vaccination for your kids that are eligible. And I'll turn it over to Dr. Hoffman.
Thanks, Sophia. Thanks, Mariah. And thanks for everyone for being here today. It's a big day for news around the COVID pandemic. Lots going on. Just start off with the 5 to 11-year-old EUA, and just, we're really excited that this day has come, and we want to strongly encourage everyone who's eligible, including those 5 to 11-year-olds, to go out and get a vaccine now that it is available. Currently, as Sophia said, the pharmacies locally are booking, and other places should be reaching out to their patients or through MyTurn in the next couple of days. We have plenty of pediatric vaccine as well, so know that the supply is here, and there is adequate supply coming for first and second doses for the pediatric vaccine. Overall, as was mentioned by both Sofia and Mariah, we are seeing really good signs of progress in the pandemic. I think that the numbers are generally headed in the right direction. We have been looking at due to that, we have been looking at how can we respond appropriately to start to loosen some restrictions that seem like the time is right. We know that some of the benchmarks that we might need to hit to really completely relax things, we still have a little ways to go. Mariah mentioned things like 8,000 people who are still partially vaccinated. One of the key things in getting to the benchmarks we need to really start to roll things back is to get to a higher level of full vaccination in our community. So again, getting those folks their second dose, getting them fully vaccinated is a priority, as Sofia mentioned, and we want to really encourage those folks to go out and get that dose so we can get to some of our goals. I want to focus today on what the kind of loosening of restrictions that we're going to be announcing today. The first thing we're going to focus on is the masking order. And so again, this is something that we're doing as we really closely watch the numbers and keep monitoring them for any signs of how the virus may be responding to our loosening of these restrictions. But we feel that it's time to start to really put out some of these, what metrics we would be using to lift the masking order. And so the details of this will be released later this afternoon, but I'm going to go over some of the basics. So number one is that we'll be lifting the outdoor masking requirement as of November 8th, next Monday. So that's the first part of the update to the masking order. The second part is setting some metrics by which we will be monitoring going forward to lift the entire order and then revert to whatever state or other agencies are requiring for in terms of masking around the pandemic. The third area of that new order is an exception for groups who are 100% fully vaccinated, with certain conditions being met to allow for those settings to happen before the removal of the entire mask mandate. And all of this is really joining in other counties in our area and in Northern California who have used similar metrics for their counties, their health departments to, really that we're using this as a way to monitor and respond appropriately to those things. So in terms of the metrics that we are going to be using to lift the mask mandate, there's three main metrics that we're going to be watching. The first one is the CDC data tracker website, which hopefully everyone's pretty familiar with now. We've been, kind of watching that since we got rid of the blueprint. The goal for that would be that we need to be 3 weeks or 21 days consecutively in the yellow tier on that, which is the moderate level of COVID for our community. The second area that we're going to be watching very closely is the hospitals and that our demand for beds in the hospital due to COVID and other respiratory viruses is not putting a strain on our local hospital system. And the third area is vaccination. And when it comes to vaccination, we've set a goal of 80% vaccination in the community, fully vaccinated, to lift the mask mandate entirely. If we do not reach that goal before mid-January, we would be reevaluating what other factors might factor into making a decision to lift the mask mandate without 80% fully vaccinated. So lots of details there. I'm sure there's gonna be a lot of questions. There's a lot, hopefully, to the information in the order itself, will hopefully explain a lot. And so looking forward to your questions today about this. Thank you.
Thank you, Director Pereira, and thank you, Dr. Hoffman. Now we'll take questions from reporters, starting with Isabella Vanderheiden from the Time Standard.
Hi, thank you for taking our questions. So earlier this week, Public Health reported unusually high case rates in the greater Fortuna area. So my question is kind of a two-parter. First, can you elaborate as to what caused this uptake in this specific region? And also, one of our reporters wants to know if Public Health has considered monitoring wastewater for COVID levels in this part of the county because of the increase.
Thanks, great questions, Isabella. So as far as how this came about, we monitor cases all across the county, and our investigations unit is really closely watching this. And I think what made us look into this more was that as we were seeing cases come down in the rest of the county, it seemed like actually cases might be going up in this region, and we were having several outbreaks there. Just in general, higher cases, it seemed. So we asked ourselves if we thought maybe the cases were actually increasing in this general vicinity, but we didn't have evidence of that. So we asked our epidemiology program to take a deeper dive into it and look at the areas that our investigations team had identified in these 5 zip codes. And they came back with some interesting data that we felt was important to share with medical providers in the community. So we were not correct. The case rates were not going up in these areas, but they were not going down as fast. And that's why it appeared like maybe they were going up. And the other piece that they found was that throughout the course of the Delta surge, that the number of cases, hospitalizations, and deaths in these areas were significantly higher than other areas. So we felt like it was an important thing to share with providers and the public. So we put that health alert together to let them know. And I'm sorry, I forgot the second part of your question.
So the second part is kind of tied into what would be my follow-up, which because of this uptick, is Public Health planning on
The wastewater,
monitoring, wastewater, and then also along with that, have you already reached out to any of these municipalities or cities about monitoring wastewater?
Yeah, wastewater management or wastewater monitoring is definitely an interesting field in COVID and virology research. Eureka has participated locally with a national CDC study. We don't have any way to do that through public health currently. There's no good guidelines on how we would use that. So it's not something that we're doing through public health, but there are research projects going on around that maybe might inform in the future how that could be done.
Okay, thank you.
Any follow-ups on the news release from earlier this week?
Yeah, I had a question, Mrs. Pereira.
Go ahead.
Can you talk a little bit about, so these were tests that were coming in from schools, or reports that were coming in, correct, from schools and facilities. Were they just the ones reporting it, or does there seem to be like a connection that that's where also those transmissions? Were you seeing clusters?
I'm having a hard time hearing you clearly, Kim. I'm not sure if.
Sorry, let me.
Okay.
A little better?
No, unfortunately.
I picked up a little bit of it, Kim. So let me see if I can try to answer it and maybe work on your microphone. So I think you're asking about clusters and kind of how we became aware of this. So public health and our investigations team around COVID, are monitoring all of the COVID positive results that come in. We sometimes are alerted to that directly from a facility, a school, a business. It is required by the state of California that if you have an exposure in your place of business or in a school, that you notify your local health jurisdiction of that exposure in the in those facilities or schools or businesses. So we get many of those calls and we deal with them. And so over a period of time, we again saw what we felt was significantly more than we had been seeing in other regions of the county kind of all at once. So we wanted to look into that a little bit more. Those come to us in a multitude of ways, either through the facilities themselves, sometimes through our interviews with people as we talk to them when they turn positive.
You hear me now?
A lot more clearly, excuse me.
Sorry. Okay. You mentioned in the press release that these were areas that also tended to have lower vaccination rates. Right? So do you believe that's probably a large part of the correlation, or is there a concern about perhaps not following some of the protocols like masking?
Yeah, it's a great question. We emphasize that vaccination rate because we do know that there is more and more data suggesting that in areas with lower vaccination rates, they have higher areas of cases, higher case rates, higher hospitalizations, and higher deaths. So we felt like it was important to point out that that correlation was happening here in Humboldt County as well.
Any additional follow-ups on that news release from earlier this week?
Yes, I do have one. Thank you. So I'm thinking about the dashboard. Has there been any further discussion at the JIC or with public health regarding, improving the dashboard in order to give the public a more accurate zip code data chart, for example, maybe numbers per capita by zip code, because that can be determined and then perhaps updated weekly in order to show the changes in those particular zip codes. I'm just thinking because previously, Dr. Hoffman, you've explained that using those cumulative numbers per zip code is not really an accurate indicator of current levels of virus. So I'm just kind of wondering if we can create a chart that better reflects that.
Yeah, I'll talk to the medical part of it, and I think Sofia might have something else to add in terms of the dashboard. As far as again, one of the reasons this kind of came up now is I think is that the cases were just so much higher in this surge than we've ever seen before. And while we have had the cumulative data on the dashboard and certainly had the ability to put it out there by, even weekly, the low numbers that we've seen tend to make it that we can't put that sort of information out because of, it could potentially, violate someone's privacy. So with the very large numbers that we saw, though, throughout the Delta surge, that was not the case. So we, took the opportunity to use that tool, which has been here but hasn't been utilized, because it felt like the right tool for that time with the larger numbers that we were seeing.
Thank you.
All right. Kim Ware from the North Coast Journal.
Okay, am I working now?
A little bit, still having a hard time hearing you.
Maybe louder?
Louder's good.
Okay, sorry. So going to the metrics, we're seeing lower numbers now. What if the issues would be a strain on the hospital system? From what I'm hearing anecdotally, there appears to still be a strain, even though our hospitalizations are down. Can you talk a little bit to that?
Yeah, absolutely. Well, I'll take two things on that. One is the hospital numbers are down quite a bit, but again, just like the cases in this surge, the hospitalizations were extraordinarily high. Over 40 cases in our hospitals at one point during the surge, when previously 12 to 14 had been, the max in our in our hospital. So we're, this week we've been hovering just under 10 locally, but there's a lot of catch up that those hospitals are doing for those 3 to 4 months of really backlog, plus the impacts of the pandemic lasting this long. Lots of deferred care, lots more advanced disease than we would be typically seeing. So yeah, there's a lot of impact still, even though COVID is less impactful, and COVID it's still itself having quite an impact. So low hospitalizations are really going to be about, what the hospital can handle. And that also plays into statewide and our regional capacity. So there's a lot that goes into it. It's hard to sum up that metric exactly, which is why I think you haven't seen any counties say, an exact number or a percentage or something like that. It's really working closely with our partners in healthcare in the county, across the state, places we transfer to make sure that if there were another surge in cases once we lifted the masking mandate, that we could handle it.
All right, thank you, Kim. Any additional follow-ups on those metrics for lifting the masking order? And we can come back to that if folks have it. Oh, go ahead, Michael.
I guess I had one quick follow-up so I guess just to make it clear, so none of those 3 metrics are currently being met as of today, right, for dropping that order? Yeah,
so we have been in the red tier consistently for months now. So, we would probably, to get 21 days in the yellow tier, we're still a ways away. And as far as the hospital capacity, as Kim mentioned, we are still seeing impacts in the hospital, and we are not yet at vaccination. So we are still probably, at best 3 weeks away. Of the counties who have adopted this type of metric, one of them has triggered it recently, and that's Marin County. They had 21 days in the yellow tier. They have extremely high vaccination rates, extremely low hospitalizations. And so they, as of Monday this week, lifted their masking mandate.
Thank you, Michael. Ryan Hudson, Red-Headed Blackwell.
Okay, thank you. So I'm thinking about winter, going into the second COVID winter here. Many healthcare workers are fatigued and frustrated after 2 years of ongoing COVID hospitalizations. And at this point, the deaths and, health officials have called them preventable, given access to vaccines and antibody treatments that are available. So many unvaccinated community members at this point are citing concerns about lack of information about vaccines or their personal preference for natural immunity as reasons for being yet unvaccinated against COVID. So my question is, what more are public health and/or county officials doing to push back against this misinformation surrounding vaccines and around the vaccine itself, or the virus itself rather, in order to minimize the impact on local hospitals to avoid another winter surge? Thanks.
Ryan, that's a really great question. So what I think we have seen in this pandemic for any of the work that we've been doing as public health is that we can't do it alone. We rely on our community partners, whether it's in healthcare or community-based organizations, faith organizations, whatever the affiliation may be. It takes an entire community to get through this pandemic and to make sure that people have information that is science-based, science-driven, and truthful. And so we have been working closely with community-based organizations, family resource centers, with our healthcare providers to make sure that we're working together in reaching those that may still have questions. I think there are folks out there that understandably, have questions and want to talk to someone that they trust. Obviously, talking to a healthcare provider, your trusted healthcare provider is a great resource. Talking, calling the Joint Information Center. We have staff there that can help answer, questions that you may have. And there's also, community-based organizations that also are committed to getting information out there as well. So it's really taking partnerships. That is how we're going to get through this.
Yeah, I would. So there's a saying in public health that we are all public health. There is. It is about everyone sharing this message together, and so misinformation and mistruths that are out there, we can put the information out there, and we do every day. But it takes everyone to help spread that message. As far as natural immunity goes, I'm glad you brought up that point. There was a really great study the CDC put out this week around natural immunity, comparing vaccination immunity to natural immunity, and just again, clear data that the vaccine is more protective, more consistent, and that even for folks who had, the data was clear that for folks who had been infected, that getting a shot was more protective than just the natural immunity alone. So I think, what we see continually is more data supporting that. And we will continue to try to correct the misinformation and mistruths that are out there. It rarely helps us to get in arguments with people who have strong convictions on the other side. We want to try to, again, correct people who are getting that misinformation, who are, truly confused and just don't know where to turn for the good information. So please reach out to the JIC if you're hearing things that don't make sense. The JIC has all the latest information, CDC, CDPH, and I think, the news outlets have been covering things really well. So but unfortunately, there's a lot of other outlets and media and ways people are getting information that is, we have no control over. And so we continue just to do our best to try to put it out there and get the community to start spreading the right message.
Thank you.
Any follow-ups on that? All right, Michael Patterson from North Coast News.
Yes, thank you. I want to go back to the discussion on the metrics for dropping the mask order real quick, specifically that goal of trying to get vaccination at 80%. So I was listening to, because it seems like Del Norte County, I believe, is also participating in this kind of metric system. But listening to Dr. Stutz talk about that, his county's limit appears to be at 55%. So I was just wondering what kind of factors contribute to why ours is at 80 and why it may be lower in a county like Del Norte, and just why these kind of metrics were set for Humboldt. Why are they right for Humboldt?
Yeah, it's a great question. So we collaborated, very closely with Del Norte and Dr. Stutz on this, and getting some sort of collaborative framework on what the metrics would be, but also recognizing that our counties are very different. The pandemic hit them much harder. Their cases, hospitalizations, and deaths were much higher. And so, and the data also that, I think they're also using different data metrics for their case rates are different. Dr. Stutz pointed out that they get one family with COVID and they're bumped out of the yellow tier. So, we have to be sensitive to these differences in the community. I think when you read the language around what we're watching for here in Humboldt County, we have some achievable and attainable goals. So 70% fully vaccinated in our community would trigger the allowance for fully vaccinated groups of 100 or less. to gather without masks if everyone was fully vaccinated, verified, and certain other conditions met. And so that is, we're around 60% right now of our community fully vaccinated, with another 8,000 people, or about 6% who could close the gap if they got their second shot. And then we add in the 5 to 11-year-olds, we could be at 70% shortly. 80% is also achievable for our community. It's a goal that was set for many counties. I think it's a realistic goal and it's a protective goal. So there are many factors that will go into this, and then we also set a time frame at which to reevaluate this if we're not meeting that goal, recognizing that if that is too much for our community, we might need to be looking at other factors. So it's again, I think achievable goals, they're accomplishable goals, and they are protective, and we're going to reevaluate them if we don't meet them come January.
I guess my kind of follow-up question to that would be, I guess some people may kind of ask then when they see this number, I mean, what exactly is the point of setting a metric now if we know we're just going to be potentially looking over it in mid-January? I mean, if the earliest we can get this done is in 3 weeks, I mean, that's basically the beginning of December. So I mean, why put a metric on it now if we may just change it in a couple months?
The idea here is we want to clearly communicate to our community what we're watching. It was asked to put these things in there when we put the masking order in place. And I think rightfully so, we waited to see what was going to happen. And so now we've experienced this Delta surge. We have a lot more data, we have a lot more evidence, we have a lot more knowledge of the virus. And so we can utilize these tools with all of that going forward. Again, it's not every county can't have the exact same metrics. I mean, even in the Bay Area, there's definitely been a lot of variation with this. So I think it's reasonable to expect that we're going to have differences in Humboldt County and Del Norte County with these metrics for lifting. But I think really the point and the basis of this is we're communicating to our communities what we're watching, and so that everyone clearly knows how we're going to get there, and that it's all based on evidence, data, and science.
Great, thank you.
Thank you, Michael. We've got about 10 minutes left. Any additional follow-ups on the lifting of the masking order or Michael's question specifically? All right, we'll go back to Isabella from the Time Standard.
Hi, I would just quickly like to ask if there is a current figure on how many at-home testing kits users have reported to the county, and also if public health's COVID testing has been impacted recently.
Isabel, was that at-home testing?
Yeah, so the first part was if there is any figures on if the county's tracking at home, and then the second part, if county testing has been impacted.
Yeah, so we don't have any current tracking system for at-home testing. We've certainly had cases reported to us either through schools, businesses, people calling us through the JIC, through our investigations unit, and we direct those folks to get a confirmatory PCR test at either a lab or a pharmacy, their doctor's office, or from Optum. So we, in terms of it, I guess, impact on testing lately, testing's down statewide as the surge has receded. And the testing capacity remains very, very good. There's plenty of capacity at Optum, so definitely want to encourage people to use all of those sites. I know a lot of the pharmacies are still testing, and so those are good options, or through your healthcare provider. whether or not at-home tests have any significant impact on the use of other testing sites, I think is still to be determined. You know, we will continue to monitor that, and if there's some need to, you know, to act differently, I think we will. The only other thing I'll say is just on the at-home test. I think part of the health alert to the providers this week was also to help them understand what to do with at-home test positives, because there was some previous guidance, but it wasn't really necessarily aimed directly at providers. So we wanted to make sure that they were armed with the most accurate information if they do get a report of an at-home test from one of their patients.
Thank you. I really appreciate you touching on that.
Thanks, Isabella. Kim from the North Coast Journal.
Hi. Just to touch back on something that was mentioned earlier, you're seeing a lot of people coming in for their booster shot. But you wanted to emphasize also that, you know, if this is your first or second, we'll get you in. Are the majority of people coming in to at least the county availabilities for the vaccine mainly coming in for boosters? Is that what you're seeing?
Yeah, Kim, yes, that is mainly what we're seeing. But to give context on that, you know, our mobile clinics, we knew that we were going to be getting smaller numbers when we were doing our mobile clinics, right? It was to focus on reaching people in all different parts of the county. And if you think about the timeline of, you know, if you needed to be 6 months out from being fully vaccinated for Moderna and Pfizer, for example, that's getting back to our mass vaccination days where you're having thousands and thousands of people eligible for their boosters. So it's completely understandable that we are seeing more folks getting their boosters at our clinics because our mobile clinics on some level, we're not going to ever compete with the scale that we were doing in mass vaccination. So we are seeing more people get their boosters, but we are continuing to see people get their first and second doses at our clinics, which is really reassuring. So that's why we just really want to emphasize that we have enough vaccine for those that are getting their first and second doses, because there obviously is a high demand for boosters.
Thanks, Kim. Ryan from the Redheaded Black Belt.
Hi, if I could just quickly get an update as to comorbidities that we're seeing lately with elderly patients here in Humboldt County. If you could elaborate in a general way about what kind of things are leading to deaths in Humboldt. Thank you.
Yeah, great question, Ryan. We're not seeing anything different than what the federal and state data are suggesting. You know, we're really seeing that for the older population, I mean, over 65 really is kind of the highest risk group. And that's, you know, the reason we focused on them early in the vaccine effort, and, you know, continue to focus on them with the booster effort in terms of who we want to get boosters out to. Those are people who tend to have more comorbidities in general. Diabetes, hypertension, heart disease, liver disease, kidney disease, you know, things that are very common in our community, and especially as we get older. So yeah, and then I think I've highlighted in several of the past Board of Supervisors updates that you know, we are seeing a pretty significant difference between the ages of people who are getting hospitalized, who are unvaccinated versus the fully vaccinated. And you know, I'll just say too that even the comorbidities of those folks who are younger are significantly less than the comorbidities of that older fully vaccinated group who are getting hospitalized. So it really is stark how much the vaccine is protective. And so these young folks without a lot of comorbidities or no comorbidities are getting hospitalized who are unvaccinated, and the folks who are really older and have multiple comorbidities but are fully vaccinated are the ones that we are seeing get hospitalized who are fully vaccinated. So focusing our efforts on those folks for boosters, and if they're immunocompromised, getting them a full immunocompromised dose.
Thank you. I appreciate that. That was on behalf of Matt Lefevre. Thanks.
Thanks for bringing his questions too, Ryan. I appreciate that. Michael from North Coast News, do you have a final question?
Yes, just real quick about pediatric vaccines. How many doses of the pediatric vaccine does the county have on hand? And are you worried about scarcity at this point now that they're available to this group?
There is no concern for scarcity whatsoever. The county, several sites have been allocated several thousand doses over the course of this first week. We don't have any visibility into what the pharmacies get, but obviously they're opening up appointments, so I'm assuming they have plenty of vaccine to cover those. And the federal government and CDPH are clearly letting us know that the orders will be filled as we put them in the coming weeks. So I think what you're seeing right now already is that appointments are open, they're getting booked, and there should be plenty of appointments for folks.
Great, thank you.
Thank you all very much for being here today, both to our panelists and our media representatives. I'll get the recording out to media shortly, and as Dr. Hoffman mentioned, we'll be releasing additional details, or full details, I should say, about the lifting of the mask order in the next few hours. Thank you again, and have a great day.